I'm Beverly Kirk, here with Todd Summers. He is a senior advisor with CSIS's Global Health Policy Center, which has just released a new report called Global Health Policy in the Second Obama Term. Thanks for being here.
Sure, happy to be here.
You're talking specifically about multilateral institutions. Talk about the role these organizations play in U.S. policy and why should we be paying attention to the impact they may be having on U.S. foreign policy.
What we're articulating here is an important agenda for the U.S. as it prosecutes its global health strategy to understand and support and help improve these multilateral institutions. The reason is that essentially by working together, those institutions allow us and implementing countries, the developing countries are trying to help, to do a better job. They provide services that we can't do on our own as a single country.
And the role is growing, correct?
Absolutely, the role is growing, although, to be honest, one of the challenges that many of these institutions are facing is a constrained resource environment. Budgets are getting very tight. The global economy is obviously challenged. So a lot of these institutions are trying to figure out how to do more with less. And frankly, they're also being put under pressure to be able to justify the value add they bring for the money that's being put into them. So they're having a harder time raising money, and they're having to do more to justify the money that they're getting.
But one of the things that the report found is that since these are tight economic times, people have actually stepped up and they're actually able to do more with less. Is that not correct?
That's absolutely true. So let's take the Gavi Alliance, for example. Gavi helps to support developing countries to improve immunization rates for children using a range of existing and some new vaccines. And the U.S. is able to pool its money with a number of other donors and together to work with a lot of these developing countries to procure these medicines at the best possible rate and then to get those out quickly to the children that need them. And actually, it's that pooling effect that allows the Gavi Alliance to obtain prices that countries could not get on their own, or the U.S. could probably not secure even with its significant contribution. So it's that working together that actually helps to improve the cost, and improving the cost means we get more kids immunized.
And one of the other features that I read about in the report is that sometimes it's helpful if the U.S. conducts its business via a multilateral organization, so it's not seen as the sole unilateral actor in an area.
Absolutely true. You know, often, especially in the political environment, the polemic becomes, do we do bilateral or do we do multilateral? And the truth is, you do both. There are advantages to bilateral relationships. The U.S. has much more direct control over the resources. Oftentimes, it's connected to kind of a political agenda. That's fine, but multilaterals bring us together with other donors and with a range of other institutions. And so what we're actually arguing is that the U.S. should pursue both the bilateral and a multilateral agenda. Exactly how that formula works depends on the issue that we're seeking to address. The Global Fund to fight AIDS, tuberculosis, and malaria actually helps to supplement and leverage the U.S. support by bringing in other donors. We are about 30%, and we get a 2-to-1 match from other donors. So we put our money in, we get $2 from other donors, and those go to developing countries to fight those diseases. So in the cases of malaria and HIV, we actually do better by both prosecuting a bilateral agenda and by joining in the Global Fund.
Looking ahead here in President Obama's second term, how do you foresee this relationship between the U.S. and the multilaterals working in terms of pursuing, I guess, shared goals, the things that both sides really want to advance?
Well, I guess I'd characterize it as a period where we're encouraging tough love, where we think that these institutions are incredibly important, but each one faces a series of challenges and also has some weaknesses. So we've in the report, we outline some of the areas where we've seen tremendous progress, but we also identify areas where we see some shortcomings and where the U.S. in particular can weigh in to help strengthen those organizations. So we make the case that they're important, but we also make the case that the U.S. should invest in a significant and senior way in ensuring that those organizations continue to improve.
And how likely is it to get congressional support? Again, we've talked about the tough economic budget situation that the U.S. faces. And there are complaints from some about how much money goes to multilateral organizations. Can you look into your crystal ball and say Congress is likely to continue supporting because of X, Y, or Z reason? This is very good for us to do?
No one intelligent in Washington ever tries to second guess what Congress is going to try to do. I do think that there is a mixed view of multilaterals. On the one hand, there's concern that joining with a lot of others diffuses the credibility and the credit that goes to the U.S. government, as well as its own ability to directly manage how the monies are used in country. On the other hand, there's quite a bit of congressional support for Gavi and the Global Fund. I think there's large awareness, although probably we could do better in how the WHO and the World Bank and others play an important role as well.
All right. Todd Summers, thank you so much.
Happy to do it.